You are dispatched to a fall from height. On arrival, you find a 24-year-old male at the bottom of a flight of stairs. He's got a large hematoma over his temple. His eyes are closed. When you pinch his trapezius, he moans and his left arm pulls inward toward his chest. But he doesn't open his eyes. His breathing is irregular and slow. In this moment, you aren't just looking at head injury, you're looking at a battle for cerebral perfusion. This is traumatic brain injury, or TBI. And clear. So ideally we make extra space. To understand TBI, we have to look at the two hits. The primary injury, this is the immediate physical damage, the coup, contra coup, the axial shearing, or the skull fracture. It happens the moment at impact, and as EMTs, we can't undo it. The secondary injury, this is the real enemy. This is swelling, hypoxia, and hypotension that happen after crash. Our entire goal in the pre-hospital setting is to prevent this second hit. If the brain is already bruised, it cannot tolerate even a minute of low oxygen or low blood pressure. Signs of rising pressure: as the brain swells inside a rigid, non-expanding skull, pressure increases. This is intracranial pressure. This is intracranial pressure, or ICP. Keep a sharp eye out for Cushing's triad. It is a late, ominous sign that the brain is beginning to herniate. Look for hypertension, a widening pulse pressure, the number on top goes up, bradycardia, the heart rate drops, irregular respirations like Cheyne-Stokes. Check the pupils. A blown or fixed and dilated pupil on one side usually tells you the brain is being pushed down into the third cranial nerve. So how do you treat it? We focus on the H-bombs. Now, we must avoid them at all costs. Hypoxia, keep oxygen saturation at 94% or higher. Hypotension, even one soft blood pressure reading can double the mortality rate in TBI patients. And hyperventilation. Unless you see active signs of herniation, do not bag the patient too fast. Overventilating causes vasoconstriction, which actually starves the brain of blood. Maintain spinal precautions. Keep the head of the stretcher at 30 degrees if the BP allows. Get to a level 1 trauma center. Remember, in TBI, time is tissue. Your job is to keep that brain oxygenated and perfused until the surgeons can take over. In conclusion, assess the GCS, monitor vitals, and watch those pupils. You are the brain's first line of defense.